For me, women's health issues are a major part of my work as a GP. Many women find having a hysterectomy a daunting prospect. But now, Birmingham Women's Hospital have developed a radical new approach to psychologically preparing women for their hysterectomy. It's brought about great changes to the patient experience and a reduction to recovery times. NHS Local has been to find out more.
Everybody wants to get home as soon as possible after they've had an operation. Women having hysterectomies at Birmingham Women's Hospital are now able to go home on average in just 3 days instead of the usual 5. It's called enhanced recovery.
A small part of it is to reduce hospital stay, but really a bigger part of it is to enhance their recovery afterwards as well. So trying to get women back to their normal lives as quickly as possible.
They are able to recover quicker with just mere fact that we can actually get them to mobilise quickly, we can get them to eat and drink quickly soon after their operation, and that earlier recovery leads them to have a much quicker long-term recovery.
Patient psychological preparation starts well before the operation itself. At every stage of their journey, patients are given information about the hysterectomy procedure and the steps they can take to improve their recovery.
I remember my sister having done donkeys years ago. It was about 2 weeks, I think.
That she was in hospital?
Yeah.
Yes. I mean, now things have changed. Things have changed quite a lot, and we now know that people don't need to stay in hospital for that long. And usually we get you up and about by the first day.
I'm just surprised it's such a short time.
Patients really rely on information that their doctors give them. So if they're told that they can't do something for 6 weeks or 3 months, then usually they won't. Whereas if you tell them that they can do things earlier or as soon as they feel like they're able to do things, you actually find that they will do things probably 2 or 3 weeks earlier than traditionally we thought they could.
So far, so good.
It's a multidisciplinary approach, giving the right information and encouragement to the patient at every stage.
I think the important thing is to sort of dispel a lot of the myths that people might come in with. The preparation in terms of pre-op, by equipping people with the information that they need. Their expectations on the other side of things are a little bit more positive, and they get back to normal, from my experience, much more quickly.
Janesh Gupta and his team have developed improvements to their surgical techniques, helping to reduce the length of the operation and minimise post-operative complications.
So we're now closing. I think she'll be pleased with that.
After their operation, effective pain relief means that patients can get up and about sooner.
We've noticed that patients can recover quicker because they're in less pain after their operation, usually in the first 12 to 24 hours. But I think the major benefit is what we have told patients beforehand, getting them to agree that yes, it is possible to get up and about quickly after the procedure. And I think that early mobilisation has made a big difference.
To further improve patient experience and enhance recovery, the team are carrying out research to measure the success of their psychological preparation approach.
We've been interviewing our patients who've been having hysterectomies right the way from before their hysterectomy up until 3 months afterwards to see what their experiences have been like and how we can help their recovery. We've also been getting some information from our clinicians, so gynaecologists across the country, and also from our local GPs to gauge their opinions and to see how we can actually help our patients recover better.
They've commissioned a DVD explaining the hospital's hysterectomy pathway. It's being used in a randomised controlled trial to see what difference it could make to their recovery.
To get back to normal as soon as possible.
If this DVD does provide the intervention that we're expecting it to provide and enhances recovery, there's no reason why similar DVDs can't be made for other areas of surgery, and it could actually revolutionise the way that recovery happens for patients and the kinds of resources they've got for patients.
You know, if you feel okay, a bit later on, be able to get off home today.
Thank you for what you're doing in that.
It's all about empowering patients. It's all about giving them the resources that they need to take control of their own health and their own recovery, and give them the confidence and the resources they need to get better quicker.